Chapter 15, Recall Plan for Human Food, presented by David Rosson. The preventive controls for human food regulation requires the development of a written recall plan when a hazard analysis identifies a hazard requiring a preventive control. This module reviews definitions of recall classes, resources for developing a recall plan, and the required elements of a recall plan, i.e., whom to notify when a recall is necessary, how to conduct effectiveness checks, and methods that can be used to dispose of affected product. By the end of this chapter, participants will be able to define recall classifications 1, 2, and 3. Recognize the requirements of a recall plan. Identify resources for developing a recall plan. Describe elements of a written recall plan. Notification, effectiveness checks, and disposition of product. Recalls are actions taken by a facility to remove a product from the market that may be adulterated, misbranded, or violate regulations in some way. In other words, a product for which the FDA or a state could take legal action against the facility would be subject to a recall. It is important to note that a recall is different from a market withdrawal and stock recovery. In a market withdrawal, it is the company's removal or correction of a distributed product, which involves a minor violation that would not be subject to legal action by the FDA, or which involves no violation. A stock recovery is when the company corrects or removes a product where that product has not left direct control of the facility. The numerical designation 1, 2, or 3 are assigned by FDA to a particular product. Recall to indicate the relative degree of health hazard presented by the product being recalled. A Class 1 is a situation in which there is a reasonable probability that the use of or exposure to a violative product will cause serious adverse health consequences or death. Class 2 is a situation in which use of or exposure to a violative product may cause temporary or medically reversible adverse health consequences, or where the probability of serious health consequences is remote. And a Class 3 recall is a situation in which use of or exposure to a violative product is not likely to cause illness or injury. Typically, a firm voluntarily conducts a product recall, either of their own accord, or at the request of the FDA, or at the request of a state regulatory program. However, the FDA has mandatory recall authority, which is the ability to require a firm to conduct a recall in Class 1 situations. Check out this definition. Consignee, anyone who received, purchased, or used the product being recalled. Make sure you check out 21 CFR 7.3, paragraph M. A recall plan is required when a hazard analysis identifies a hazard that requires a preventive control for the specific product. The recall plan must be written and implemented before an adverse event takes place to ensure that actions taken to recall a product are conducted efficiently and quickly. A rapid response is especially important for Class 1 and Class 2 recalls for which public health is at risk. The written recall plan must include procedures that describe the steps to take and assign the responsibility for taking those steps to a specific person or role. People can be assigned to multiple tasks, but the roles should be predetermined to support a quick response. The required written procedures are 1. Direct customer notification when required. See text box about the food being recalled, including how to return or dispose of the affected product. 2. Public notification about any hazard presented by the food when appropriate to protect public health. 3. Effectiveness checks to verify that the recall was carried out. And 4. appropriate disposition of the food through reprocessing, reworking, diverting to a use that does not present a safety concern, or destroying the food. While a recall plan is only required by regulation when the facility has identified, through the hazard analysis, a hazard requiring a preventive control, common practice is for the firm to have a recall plan regardless. Notification of customers is required for Class 1 recalls and sometimes for Class 2 recalls when there is a threat to public health. Decisions on when notification is necessary can be determined through discussions with the FDA. The FDA has the authority to initiate a recall in Class 1 situations, but typically a company voluntarily issues the recall notice. The owner, operator, or agent in charge of a facility is accountable for the safety of the food and must ensure that a recall plan is written. The individuals who will function as the recall coordinator and the recall team are typically identified prior to a recall occurring. The recall coordinator generally has the duties identified on the slide. The recall team should include all functions necessary to collect accurate and complete information in the event of a recall. For example, production, shipping, quality assurance, sales, and administrative personnel should be considered as members of the recall team. If the facility has multiple locations, the team may include corporate team members from different departments, e.g., safety, quality assurance, distribution, etc. Each recall team member should have clearly defined roles. The recall plan should define each step of the recall process, clearly describing what tasks need to be done each step and assigning responsibility for carrying out the step or task. Knowing the recall procedure, steps, tasks, and responsible roles ahead of time, and then practicing the procedure reduces potential confusion and helps to support an organized and quick response. Responsibility should clearly define who will initiate the recall and who will notify external customers. Clear documentation helps define the extent of the recall. While several employees may be involved in gathering different types of documents, one individual should be responsible for compiling the information and data gathered to ensure that a complete picture of the situation is available. Assign responsibility for each of the types of documents needed to ensure that everything is completed. Frequently, when recalls occur, some of the affected product is still in the company's control, some of the affected product is in the possession of customers, and some of the affected product may be en route to customers. In addition to the responsibility of notifying customers, when a recall occurs, the company should assign responsibility and define procedures for securing inventory that is still within the company's control to avoid contributing to the problem by inadvertently shipping products subject to the recall. All product lots involved in a recall must be accurately identified. Specific information on how lots are identified should be easily understood by all the stakeholders that receive this information during a recall investigation. Unclear or poorly identified lots hamper the effectiveness of any recall effort and increase the amount of time and resources needed to complete the recall. It is critical that lot records are clearly identified and stored so that they are rapidly accessible in the event of a recall. Be sure to consider how rework is used in a facility. If rework from an implicated lot is used in subsequent lots, the amount of product involved in the recall may expand beyond the originally implicated lot. All information should be cross-checked against multiple sources and through multiple people so that the accuracy can be verified prior to initiation of the recall. Incomplete or erroneous information causes confusion and delays in transmitting information necessary for product recovery. It cannot be overemphasized that correct information based on complete and accurate records is a critical requirement for efficient recall activities. Government agencies will review these records, and a lack of records organization can slow down the process. When it is determined that a recall is necessary, notify the appropriate regulatory agencies. In addition to the FDA contacts, see text box and FDA state recall coordinators, link on the slide. Many states have recall coordinators. It is useful to include their contact information in the recall plan. In some cases, an agency may notify the facility company first. For example, if a foodborne illness is traced back to the facility's product. In other cases, the facility may need to initiate contact, such as if the facility company receives several calls from consumers regarding an allergic reaction to the company's product, and the facility company determines that the product has an allergen that was not listed on the label. The recall plan must include procedures for notification of outside customers, consignees who received product. Procedures should describe how to inform customers of the type of product, quantities of affected product shipped, dates product was shipped, and the reason for the recall. The procedures should also tell customers to immediately put the product on hold to prevent further distribution. Information regarding recalled product may be requested for customers to report back to the facility. Once information is gathered by the facility, disposition of the product will be determined, as well as effectiveness of the recall effort. A press or news release is usually used to inform the public of a recall that has a public health issue. While a detailed press release cannot be developed until an incident occurs, a recall plan can include templates that describe the information that would be inserted and should identify how to distribute a press release if necessary. The FDA must approve the press release for FDA-ordered recalls, and so the FDA has model press release examples available. See additional reading, resources, and references at the end of the chapter. The Reportable Food Registry, RFR, is an electronic portal for industry to report when there is reasonable probability that a food will cause serious adverse health consequences. The facility must report issues that the facility finds. The RFR is also useful for investigating information on foods that have been reported. The FDA posts recall notices on their website. Model recall notices are available, which could use to create a draft recall notice for the facility's recall plan. The FDA also provides contact information for recall coordinators on the web. Include this information in the recall plan and consider getting to know them prior to a recall situation. For example, several states have food safety task force meetings that provide access to regulatory officials in an open forum. See additional reading, resources, and references at the end of the chapter. The purpose of an effectiveness check is to verify the recall communication was received by the direct account consignee and that they understood and followed the recall instructions. The effectiveness check should also verify the recall reached the appropriate level in the distribution chain. An effectiveness check is a means of evaluating the effectiveness of the recall, e.g., the recalled product was removed from the marketplace. If the effectiveness checks indicate that the recall communication was not received and/or its instructions were not followed, then additional steps must be taken to make the recall effective. These steps may involve using alternative means of contacting customers or sending out a follow-up communication that more clearly identifies the product, better explains the problem, and/or provides clearer instructions to the consignees. There are model documents available from the FDA. If a recalling company's actions do not adequately protect the public from a violative product, i.e., the company fails to initiate a recall effectively, the FDA may consider taking other appropriate actions. Note that some state regulatory programs have their own requirements for recalls. The recall plan must include procedures that describe the steps taken to determine the appropriate disposition of the recalled product. Depending on the specific hazard and the product involved, sometimes a product can be reconditioned or reworked to eliminate the hazard. Diverting the product to another use, such as animal food production, may also be an option if it does not present a safety concern to animal health. As discussed in Chapter 2, if the facility plans to divert the product to animal food use, the product must comply with the preventive controls for animal food regulation. So it is recommended that the recall plan address how to meet these requirements if animal food diversion is identified as an option. Destruction of the product is the final option and is sometimes necessary. Consult with the regulatory agency for approval when applicable. Procedures for product disposition need to consider both the product that is under the facility's control and product that is returned from customers and consumers. In some cases, a recall plan may direct customers and consumers to destroy the product rather than returning it. Such situations should be described in the facility's recall plan. Regardless of disposition approach, a clear accounting of the amount of recalled product requiring action and its disposition is needed to close out a recall. It may be possible to divert product for animal food use. See the discussion on GMPs for animal food use and the preventive controls for animal food regulation for more information. The definition of roles for a recall is important. The owner, operator, or agent in charge of a facility is accountable for the safety of the food and must ensure that a recall plan is written. A recall coordinator and recall team are typically identified ahead of time. Lists of stakeholders who should be notified, including consignees and regulators, in advance of a recall can be helpful. Product lots involved in a recall must be accurately identified. How this is done is dictated by how materials are tracked from incoming goods through the process and into distribution, as well as how a lot is defined. Recall efforts involve identifying specific lots that might be implicated and then tracing those product lots through the distribution system to ensure that all product that has not already been consumed is recovered. These are critical records. Examples of records which may support recall plans and activities include production records determine tracing and tracking of all ingredients from receipt and warehousing through production and shipment of finished goods. The facility must have documentation to support the decision on which lots are subject to the recall. For process-related recall issues, proper identification of the affected production lots, a list of consignees who received implicated products and contact records, and reconciliation of what product was recovered, reworked, scrapped, unshipped, etc. When a recall occurs, reanalysis, see Chapter 14 in your manual, of the food safety plan is required to determine how to prevent a recurring situation. Once the recall plan is developed, it is important to periodically test the system to ensure that it will work if a recall is necessary. This is sometimes referred to a mock recall. The FDA has resources for developing a recall plan in its guidance documents. The guidance discusses what preparations facilities in a distribution chain, including manufacturers and distributors, should consider in order to establish recall initiation procedures to ensure timely identification of and response to product problems that might lead to a recall, and to promptly issue recall communications and press releases or other public notices. FDA resources also discuss preparations facilities in the distribution chain should consider making to ensure timely responses to a recall communication. Additionally, it discusses how the FDA assists companies with carrying out their recall responsibilities to protect the public health from distributed products in violation of the FD&C Act and other regulations administered by FDA. Another document from the FDA provides guidance and recommendations to FDA-regulated industry about what information companies should provide to the FDA and how they should notify their customers about product recalls. FSPCA's recall template is available on the FSPCA website. See QR code next to the slide. And at the end of this chapter, a recall plan is needed when a hazard requiring a preventive control is identified. The regulation requires that the recall plan include notification procedures for those affected by the recall, how and when effectiveness checks are to be completed, and that assures proper disposition is carried out under consultation with FDA and other regulatory authorities as appropriate. You have completed the lecture for Chapter 15. Be sure to complete the knowledge check as well as the Chapter 15 exercise. See you in Chapter 16.